Woo. Thanks for coming, everyone. It's a great turnout. Appreciate it. Yeah, today we're going to talk about neck and low back issues. So we're looking for a lot of the common problems that people have with neck and low back. Just a couple of the bullets that we're going to hit here, we're just looking at ways to improve and or manage both neck and low back pain, how chiropractic care can benefit neck and low back issues, and how guided exercises, posture changes, and stretching can help. These are all just to kind of go back into research. You know, so much of what we do in our practice is based on what the best evidence is showing. Best evidence shows that only chiropractic or only exercise or only stretching is not the best way to approach most health conditions, that you need what we call like a multimodal approach, meaning from our point of view, we adjust the spine, get the joints to move better. That helps the nervous system calm down. It helps muscles relax. We do soft tissue work to encourage the muscles to stay more flexible. We give you prescribed exercises or direction and postural changes related to like work situations or driving a car or how you might sleep. Because the patterns of your life and how you do things inherently dictates the problems that you see with neck and low back problems. And in many health conditions, that's exactly where it comes from, right? I don't think anyone would say that a person that has diabetes knew that they ate 4 cookies one day and they had diabetes. It took 20 years for that to become a problem, right? So the postures, the positions, the behaviors that we take and do every single day determine the outcome of what some of you may be feeling when it comes to recurrent or chronic back problems, neck problems. The other common issues, right, are going to be traumas. And those are the easy ones to see because if somebody falls off a bike and hits their head on the ground, like we know they might have a certain problem, right? So that's an easy one to put your finger on. It's super common to have somebody come in and just be like, I don't know what I did, but I just picked up my son and all of a sudden my neck started hurting and I had tingling in my hand. They're like, I didn't even do anything. And then you take an image of their neck or you see them and all of a sudden you can see a degenerative process that's occurred over years that is just manifested in that one moment that caused that problem to occur, okay? I just put down here some statistics. So I was thinking as I was putting this together, like, you know, what are some of the things that kind of hit home for people to understand how big of a deal neck and low back pain are? And the first one here is, it just says prevalence of neck pain. So if you guys just read along, it basically says the economic burden of neck pain is remarkable and includes treatment costs, reduced productivity, and job-related problems. In 2016, so this is 10 years ago now, skip forward, low back and neck pain had the highest healthcare spending in the United States at $134.5 billion. So the cost of neck and low back pain to people and businesses and the economy is large, very large. 50 to 85% of the people in the population will experience some form of neck pain in their lifetime. That goes for back pain too. The statistic for low back pain is somewhere more around 80 to 85% of people will experience low back pain at some point in their life. And so yeah, prevalence of low back pain in 2020, it's estimated the number of cases will increase to 843 million cases by 2050. It's the single leading cause of disability worldwide. So at least one of you or all of you know someone who's been severely hindered by low back pain in their life, whether it means they've had to stop working or stop doing things that they love to do, or just completely change the path of their life. Low back pain can be experienced at any age. I'd say most commonly we start seeing people that have low back pain in their mid-20s to their 50s. Different problems occur in your younger years. As far as back pain, there's more common problems that we see in young people than we do middle-aged people and what we see with older people. So, it depends on what's going on with you, but age can determine that. And again, like we said in the very beginning, past history of all the little traumas of things that have happened in your life can lead to the problems that occur now. Prevalence increases with age up to 80 years old. Typically, we don't see a lot of back problems beyond 80 because the spine just starts to degenerate and fuse and stiffen up so much that it's the body's mechanism for trying to stop the problems to occur. So unfortunately, it only starts to happen around 70 to 80. So it takes a while to get there. Common age is 50 to 55, the highest number of low back pain cases. And One thing you'll hear us talk about, or maybe you have heard this before, a lot of providers will talk about back pain as non-specific low back pain. And I completely disagree with that statement. Like understanding spines, I've been doing this for 20 years now, and having, for myself, my past history, I used to be a collegiate rower, ruptured a disc in my back twice, I've had back surgery twice, and in the 20 years that I've had to go through my own back problems, I've always had to seek out knowledge in different ways than I thought I would. It never came to me by seeing my primary care provider. It never came to me by seeing my chiropractor. It never came to me by seeing my physical therapist. Like for me personally. So my own experience going through this has changed a lot of how I approach it with other people. And I feel like the experience I've been given has really helped me understand where a lot of people are, because I would argue most forms of back pain that most of you have had, I've probably had some form of it. And I've had to find my way through it, because I've never found enough guidance to really teach me like, boy, you need to do this right now, or you need to change this behavior now. It's always been a little more vague. So non-specific low back pain to me isn't a very fair statement. There should be a cause. There should be a reason. We should be able to understand that based on the tests that we do, your history, and how we evaluate you. And if that means moving on to more imaging to try to figure stuff out, then that's what we end up doing. But there should be an answer. There we go. That's the first part. So the next part here, we're going to talk about, we're just going to dive into neck pain. I kind of listed things out here in kind of a very progressive way. We're going to talk about biomechanics. We're going to talk about postures, muscle strains, ligaments, and disc injuries. So some of the most common things that we see with neck and low back problems. Dr. Rachel is going to take the floor for the neck part. So give her a big round of applause. This is the first time coming out to do this. I'm going to get you.
So like Dr. Rob said, neck pain is one of the most common causes of just injury and really just musculoskeletal conditions affecting our population. It can be a huge inconvenience. And it can be caused by a couple different things. I think a very common one that people hear the word thrown around is whiplash injuries, causing sprains and strains to the muscles and the ligaments in the neck. And what that really means is kind of your head and your neck are almost, if you think about your spine, it's like the end of a whip. So when a trauma happens, it can get thrown forward and backward, and a lot of injury can happen to this region because that's where the force ends up. And so having good posture, protective movements can really help prevent injury in other cases that are a little bit more preventative. So having good posture, standing tall, nice neutral position, our head stacked on top of our spine, rather than forward bent in a way that puts a little bit more force and pressure on the muscles in the back of our neck, can really help alleviate some other stressors that can add up to more degeneration and buildup of injury. Like muscle sprains can happen more commonly with like sports, lifting, falls, things like that, when almost overpressure happens or too fast of an uncontrolled movement. Whereas strains, that's more like, oh, I woke up with neck pain or I turned my head too fast. And they commonly happen when muscles are a little bit more relaxed, putting a bit more pressure on the joint and the ligaments themselves, putting them at risk for a little bit more injury that way.
So, yeah, so the three most common kinds of issues we have here, right? We have muscle strains, ligament injuries, and disc injuries. Those are the big ones. So muscles, try to think of when you see someone that has a muscle problem, muscle problems are typically like a secondary symptom, unless it's been a sports injury. So if you've been running along and you pull a hamstring and you feel that muscle go, that's a muscle injury, okay? But if you've been sitting at a desk all day long and your neck and shoulders and back are always so tight, the muscles that are tight are not the source of your problem. They're a secondary problem, right? So there's an underlying reason why the muscles are behaving that way. And it's important to try to understand that the muscle isn't the cause of the problem. Even though you rub on a muscle and it feels better, that doesn't mean the underlying problem is fixed. So for a lot of people, they have neck tension, headaches, back pain, they go and get massage, they feel good for a week or two, and then the problem comes right back. Or it might even last a day or two. So when that happens, what I try to encourage people to do is pay attention to that pattern. Like if it's not getting better, or it only has a short period of relief, there's an underlying source to that problem, okay? And finding out what that is going to be important. Again, muscle strains in particular, we'll just talk about that one and put it to bed. Muscle strains, again, sports injuries, lifting injuries, falls, things like that, where you've jarred something and it hurts the muscle. Those are relatively straightforward. So think of the muscles as, they're just the levers of the body. And they have a lot of blood flow, they have a lot of neurologic input, they heal quickly. They're designed to heal quickly to keep you moving. So if you have a strain injury, if you have a strain injury, it should heal up within a couple weeks. You should see the bruising go down, the swelling go down, the tightness should go down. You get a massage, boom. It should be cleaned up pretty quick. If it doesn't go away, then you might have something deeper going on. So ligaments tend to be that part of the problem. Super common things we hear, someone woke up with neck pain or turned their head too fast, and all of a sudden they've got this tweak in their neck and they can turn their head good one way but not the other, tip their head, it hurts and it's painful. What happens there is, think of, if you've seen a picture of a spine, right? We have 24 vertebrae, they're all stacked up, they're all tiny little bones, and if you just stacked them up on a piece of wood or something like that, it wouldn't take much to knock them over, okay? So the ligaments, think of wrapping the whole spine in saran wrap. That's kind of what ligaments are like. And we have those tissues all throughout joints in our body and between muscles. Those ligaments, think of them as that's what holds the spine together. Like at the deepest level, those ligaments are what holds it together. And then muscles attach through those ligaments to the bones. The muscles then are pulling, hopefully symmetrically, to try to create tension around that part of your body, the spine, to allow you to move and function, okay? So if you have something like Dr. Rachel said, a whiplash injury, a car accident where things get whipped really hard, those muscles don't have the capacity to slow the body down, and those ligaments take all the stress. When the ligaments take all that stress, the brain sees that the spine is a bit unstable, and when it feels that instability, it pulls those muscles around real tight and doesn't let go. So very commonly in a car accident situation, you see a sprain injury and it takes much longer to heal. Ligaments don't have blood supply. They don't have the kind of recovery that you see with muscles. So it takes much longer and it's a different form of rehabilitation. And then kind of just going back to where it says non-specific pain, like low back pain, I'm definitely a firm believer that discs are probably one of the biggest sources of problems that people have with their spines. Discs are, the analogy I love to use is think of like a jelly donut. You've got this thing between all of the vertebrae in your spine, and it's got a hard outer shell but a soft squishy inside. And if you played with a jelly donut, like maybe a water balloon, and you just squeeze it on the outside, you can see it kind of gooing that way. But if you squeezed it really hard, it could pop and explode the opposite direction. So think of someone who is in a car accident and their head whips so hard that that jelly donut gets squeezed extremely forcefully in one direction and ejects that jelly donut the opposite way. So that's a very bad situation, but it's a common situation with people that have neck injuries. The problem with a disc injury, what I just described, is a very dramatic event. But the more common way you see problems occur is like sitting at a desk and just looking at a computer, or maybe you work at a laptop, and so your daily head position is forward and down, and you're just constantly looking forward. And then maybe you play video games with your kid or something like that, so then you sit and have a head forward posture, and then you sleep with a pillow that pushes your head up in this position, and then one day you go down to pick up a bag of groceries, and all of a sudden you have neck pain. Like, that repeated effort of having your body in this abnormal position causes stress on that disc that can cause a failure at any point in time. It's just so important to recognize that a disc tissue can cause pain before it's a big, obvious, bad problem. And this is where I think the greater part of the medical world misses it. In school, we're taught to look at things with orthopedic tests, and orthopedic tests have things called, we measure them by what's called sensitivity and specificity. So if a test has a very high sensitivity and a high specificity, if you test it and the test is positive, the likelihood for what you're looking for, it's most likely that what you're looking for is true. Okay, so one of those examples we can do with low back stuff is you lay on your back and you lift someone's leg up in the air like this. If they have pain within 30 to 45 degrees of leg flexion, hip flexion, on that test, the likelihood, the sensitivity and specificity is about 90% that it's a disc-related injury. And then if you take their foot and you bend their foot forward at that same elevation, and it causes back pain and leg pain, the likelihood goes up to like 95%. Okay, so you use one test to confirm the other. The problem is a person who's injured their back the first time or second time, that test is never positive. So the term nonspecific low back pain has come up because it doesn't fit the test that was designed to find the problem. The problem is the test isn't looking for the problem before it's a problem. And this is the example I gave of diabetes before. I think we all know if we sit down and eat a dozen cookies a day and we don't exercise and do bad things to our body, the likelihood is I'm going to end up in a position where that might be a problem, right? So that's the same thing here. Okay, flip the page. How many people work at computers? Yeah. How many people have neck pain, shoulder pain, stuff like that, right? So there's a lot that we can do to try to modify those postures and positions. The thing that I like to tell people is like, the easy answer is quit your job. Stop doing what causes the problem, right? That's so simple. Like if your thumb hurts, don't hit it again with a hammer. Like that hurts. Don't do it. But the problem is we all need to live and function, pay for our houses, our lives, like all those things. So the conversation then becomes, like in our offices, then what do we do to modify how you're sitting at a computer, or how many computer screens you have, the level of which they sit, or your seat. I mean, you have to work through all of those things as much as you can. Just like you might need to stand up more often, or take more breaks, or do more shoulder mobility stuff like during your workday. Like finding the rhythm or routine that helps you thrive is really important. But it also might be that you may need to learn to manage what you have going on, right? So if you have neck pain or back pain, sometimes it's not just about do 4 exercises and it's all better, because you might just go right back to what you were doing and have that problem again. So let's have everybody stand up. All right. So grab a partner and have one person kind of stand and turn sideways, and just stand in your normal posture. And have the other person kind of look at them. And just look at how the person you're looking at, so whoever's looking at the person who's doing their posture, like look at them and just kind of see, look if they line up, look at their ear. Does their ear line up with their shoulder? Does their shoulder line up with their hip? Does their hip line up with their knee and their ankle? Do you see these points along a line there, staying in a line? So at a very basic level, this is one way that you can start assessing yourself, your partner, your children, whoever, coworkers, if you want to talk to them like that. But like to look at them and kind of be like, okay, like there's something a bit off. Like if your ears are ahead of your shoulder, we've got a problem. The typical head weighs 8 to 12 pounds, and it's on the end of this spinal chain. So if you tip it out there even in half of an inch, it creates an exponential load on muscles and tissues on the back of the neck. So if it keeps going forward and forward all day long, imagine how much stress that starts to impart on those tissues in your neck, okay? So switch partners. Now the other person look at the other, if you haven't done that already. And just take a quick look at postures. This guy right here, I need to grab his neck. Okay. Okay, gang. Who wants to be an example? Who has like a head forward posture and they want to be an example right now? Awesome, come on up. Too slow, buddy. What's your name?
A few injured. Nathan.
Nathan, Bob.
Yeah,
Good to
Bob,
meet you.
nice to meet
I'm
you.
going to have you stand sideways right here. Perfect. Okay, so let's look at Nathan, everyone. If you all want to slide in next to the camera or come behind me, go ahead and do it, but we're just going to give some examples here. So, again, we see Nathan exercises, which is great. And if we look at his postures, we can see some accommodations that he's making to try to stack his body up in a mostly good pattern. The one caveat to all of these things is when we're striving for optimal postures, you have to take into account everyone's body shape, size, and how they're born, okay? You can't ignore the fact that he's been lifting weights for a while, he's got a strong upper body, upper back, and he's using some modifications to accommodate that, okay? And so if we look at where his shoulders are behind his hips, right? And his ear is ahead of his shoulders. Can everyone see that? Yeah, see some heads nodding. And then you can see his knees bend slightly so that his hips stay over his feet. So he's making some accommodations like in an S-shaped pattern to try to keep himself balanced and straight, right? And so the other thing is like it's pretty common with people that do a lot of heavy weightlifting that these back muscles here, they overwork. And so what you find is you find some compression back here, which causes his hips to go forward and his shoulders to go back. Okay? So very commonly in weightlifters, again, when you see, and this is a different thing, so a little plug for a month from now, we're doing a functional movement lecture, and this is some of the stuff we're going to cover. So when low back muscles get over strong, core muscles tend to be not as strong. So you don't find the balance, right, between front and back. You have a quadricep muscle and a hamstring muscle. You want the same thing. You want flexibility and strength on both sides. It's mostly equal, so the joints and the muscles function right. So in this situation, Nathan's got really good, strong back muscles. If you felt them, you could feel like they're very engaged at the moment. And his core muscles, they're working, but they're not nearly going to be as strong as what's going on here because of the way he's trained. His training has dictated this posture.
I crushed my T12 too.
And he crushed his T12 too. That'll do it too. Okay? So in this situation, you know, can we manipulate what's going on with his body and understanding more of that history like a crushed T12 or any other stuff, that gets added into the recipe of how we approach what can we do with his body to make it maybe function more optimally. Okay? So just wanted to give you guys an example here, just a real life picture of the accommodations he's making for a few different things, right? Can we modify this? We could, all right? We could teach you, he's already pulling his chin back to keep his head neutral, but he can only go so far. So for him, it's not smashing his neck backwards, it's shifting his pelvis and getting his knees to line up, right? Getting core engagement and relaxation in his back muscles to get him a little more vertical, all right? Just a different approach for each person, okay? It's not the same for everyone. Thank you.
Yeah, no problem.
Appreciate it. Anyone else feel like they really?
Do me.
Sean, you're built like Nathan.
I don't think it's the same. I don't think it's the same.
It's not the same.
Yeah.
All right, all right.
Do you want me to just do how I normally do or try to
No,
be good?
no, stand normal.
Okay.
Being good's no fun.
This is, I catch myself in the mirror all the time like, oh, it's, so normal is like this.
You know, and just to put it out there, we're not diving into everyone's history. I know Sean's history. Like, I know what's going on with his body and the kinds of things that he does. He's a phenomenal guitar player, and guitar players do all sorts of dumb stuff with their bodies to like get around their guitar. But he plays awesome, so that's what. Yeah. So again, you can kind of look at Sean, and you can see a similar pattern, right? Head forward, his ears are ahead of his shoulders, and he bends his knees a little bit to try to accommodate what's going on up here with his body. Okay, so he's a little more balanced here. He's not over-engaged through here. As much as Nathan was, but same kind of thing. Sean's feet, he's got some issues with his feet too. So if I was, again, to look at the whole body to address a postural issue, like I would be looking at his lower extremities also, right? And that plays a role in Sean's, how his body behaves.
With his feet.
I have duck feet. I have no arches.
Super flat.
Me neither.
Yeah, like so flat that like.
Yeah, I touched the ground.
Okay, yeah. And so that it makes a difference. That's the only point here, okay? So yeah, with Sean, the same thing. Like maybe a little more correctable because I know he doesn't have a T12 fracture, but if just tucking the chin in, going here and going back, right? Trying to do that, and then trying to create a little bit more like rib cage engagement. So if you actually like,
Downward.
yeah, like that, right? And even though your ears are still ahead, you're like lined up more here, and that accommodates a little bit with the knees. So if we got your knees to shift and got your ears, now we're kind of splitting hairs. Again, it's not getting it to be perfect, it's trying to improve it.
Can we try with a normal person?
Yeah, totally. Are you, so you're normal?
Yes.
All right, what's your name?
Dawn.
Dawn, hi, Bob.
Hi.
Nice to meet you. Okay, Dawn,
Okay, I'll stand normal.
all right. Can you put your hair in a ponytail, or do you have anything like that? Thank you.
Stop approaching, is that what you mean?
I mean, well, we can talk about emotions too.
All right, hands on your side. Okay. So women just, again, we could make a whole lecture on this right now, right? Like, not just you, Dawn, trust me. No, but women just have different postural differences than men. They just do, okay? Women are built slightly differently, therefore you see slightly different things. So with Dawn, just hands on your side, just look straight ahead. But again, you can see where her ears line up, right? She's an inch or two ahead of her shoulders, and you can see this little curve right here, right? And then you see this more of a bend right here in her low back. So for a lot of women tend to be a little more anteriorly pelvic tilted. It's a very common pattern with women. And so what happens is as that rolls forward, as this occurs.
You mean butt out?
Right, yeah, so back muscles overengage, abdominal muscles weaken, and so you get this posture, which then kind of kicks off a chain of events in the rest of the body, all right? And so with Dawn, yeah, I mean, definitely, I'm just gonna put my hand on your chin here, and just let your chin just slide back, right, like that, there you go. Right? And then I want you to think of, take a nice deep breath, and then exhale, and try to just tighten your ribs right here. Don't tip your head down. Put your head back. There you go. Like that. There we go. And then you would just want to think like bring in your pelvic floor, hold your stomach. Good. And she just did a little bit of reducing her pelvic tilt. So now, if you hold that, and then bring your body forward a little bit more. See, now you're moving your head again. Darn it. I know, right there. So
I'm not a good student.
So again, this isn't how I would correct this behavior, but I'm just showing you that like in her situation, Dawn's situation, it's a little more malleable. In Nathan's situation, it's a bit less malleable because of some structural damage that he has, okay? We have to work around that. So in your situation, Dawn, you're right. I mean, we can bring your head, neck back. We can teach some core stability, how to get out of anterior pelvic tilt a little bit more. And that's going to change the picture from your hips up as opposed to what's happening down below. Like just looking at the way you're standing, I'm not too worried about the lower part, right? I'm worried about more of the upper part. Okay. Did that help answer that?
I don't know.
No, I don't know.
They were just, like, they're kind of, you know, like, so we just needed more people.
Yeah, thanks, Dawn. That was awesome. Okay, love it. Okay, so some of those key things around postures, again, working on head and neck posture. There's some simple exercises we can do. Everyone go ahead and try this right now. As you're standing here, when your mouth is closed, I want you to take your hand, you're gonna put your hand on your chin, you're gonna push your chin straight back. I want you to hold your chin, like hold it back for about 10 seconds. That's also a very good stretch. So if you're at a computer all the time, push your head and neck back. It creates a stretch up here at the base of the skull that can be fairly relieving for people. Hold that for about 10 seconds. And then when you're in this position, I want you to just relax. Don't let your head fall forward, just let it relax. That would be your most neutral posture that you would want to try to attain on a daily basis based on your body. Does it mean we can modify that a little bit? Yes. But as you're doing things all day long, trying to get this back as far as you can, and then just relaxing a little bit, is about the neutral spot you want to be for your body. Okay? So that's a super good stretch. Another super easy stretch that we're going to give here. Oh yeah, I'm going to skip one. Let me have somebody sit here for me. Give an example. Yeah, Nathan, sure. You're close. Okay, perfect. All right, so this is an exercise. It's a kind of an odd one, but what I want you to do is Nathan, I want you to tuck your chin back as far as you can. Okay, good. And then what I want you to do is I want you to try to lengthen your head. So push your head into my hand. So what's funny, right? You see him kind of trying to figure out like how to do this. But the trick is I don't want you to do this, right? We don't want to be doing this stuff. We're not doing this. You're trying to get your head and neck long. There you go. Good. So yep, chin back. Good. And then push your head into my finger. Yep, try to reach longer. Like, there you go, you're doing it. But it's effectively this. You're trying to lengthen someone's head and neck. So, people come to me and they're like, how do I lengthen my neck? Can I lay on a traction table or something like that? I'm like, yeah, that'll lengthen your neck. But you can also train your body to get your muscles to work in a manner that helps you elongate your head and neck. Most people don't think it's possible until you start practicing something like this, okay?
Get them to fire, right?
What's that?
Trying to get your muscles to fire.
You're trying to get them to fire differently.
Yes.
Yeah. So the thing is this is what this is comes from a type of study that I've done through a group called DNS, and it's about trying to create different motor patterns in the body, meaning you're trying to break the patterns in which you have been acting for years. And this is one of these exercises where you're just trying to sit and lengthen and sit and lengthen. So everybody try that real quick, just standing. You can do it standing. It's kind of weird, but try to tuck your chin back and then try to think of like pushing your head away from your body. Just try to like get as tall as you can, okay? When I do that, I feel strain down the sides of my neck. I feel my shoulders depressed. Like I feel my body doing something very different than I would on a normal day. Like I'm trying to reach almost down to the floor and grab it and then lengthen away from it, okay? So it is hard, but it's worth practicing because what you're doing is you're asking muscles to activate in a pattern that they normally don't, but in a more positive way, okay? So a couple things we've already shared. Chin tuck is a good stretch. Letting it relax, kind of holding a neutral pattern. This cervical elongation exercise is a really good one just to practice. So if you are at a computer all day long, doing this cervical elongation, these are good ways to kind of work towards something different than what you've been doing all the time. Okay? Thanks, Nathan. I'm just going to buzz through these last couple things here. Chest and shoulder mobility. You know, how our shoulders and neck behave is super important, are directly tied to what our chest and shoulders are doing. So from about here up, if you have like a stretchy band or a dowel or anything, like you can do exercises where you take a band and you're doing like shoulder retractions like this, right? Now you're activating posterior muscles instead of chest muscles at a computer. You can take that band and go up and over your head and do this kind of stuff, right? You're creating shoulder mobility. This is all going to open everything up from here up. Right? It's going to give you some freedom so these muscles all through here don't feel so compressed and tight, okay? So, yeah.
I see people like warming up at the gym with like a pipe or like a pole.
For sure.
Do you say like bands warming up that way, like the bands is better, or are they even doing anything with the like, I don't know.
What they're trying to do is they're just trying to get their shoulder joint to rotate and create mobility. Like, so again, like if you wake up in the morning, you're kind of stiff, like this kind of action is a great way to get the shoulders and the chest muscles to open up and just create movement, right? So they're doing that before they choose to do some pull-ups or some weights or something like that, right? You can absolutely do it with bands also, right? So you can take it here and you can do stretching like this, right? Again, to activate back and shoulder muscles, and then up and over like this. And then you can also let the band pull you in, which stretches your chest muscles, right? So again, trying to create mobility through your shoulders is going to relax what's going on up through here. So if you have chronic headaches, neck pain, tension, computer neck stuff, like that all helps. Good question. Stretches, some of the easiest stretches you can do if you're seated is to take one hand, grab onto a chair, sit on a hand, tip your head away on the opposite side. Everybody can just do that. You feel a pretty good stretch through your upper traps, right? Super easy stretches to do, and just trying to kind of, again, keep this stuff as loose as you can during the day is really important. The last bullet I've got here is like, so what does chiropractic do for stuff like this? The way I understand how the physiology works is repeated patterns in the body, like we've been talking about, are going to create more muscle tension, more muscle stiffness, and it just kind of builds up. Chiropractic is awesome because it goes in there and we undo the foundation, meaning we get the bones in the joints to start to move and become more mobile. When that happens, the nervous system calms down a little bit, and then muscles relax around it. And then if we do what we do in our office is we do some soft tissue work, we do some stretches, we do some exercises to promote the behaviors that we're trying to encourage. Chiropractic is repetitive, at least in the first month or so, to try to break those habits of what the body is doing. And then for us, we try to taper people off and then proactively enable you to do it on your own as much as you can, right? So can you stretch and use activities or bands or whatever to help you maintain where you're at? And if you can, great. If you can't, then maybe you're a person who needs to get adjusted once a month or once every 2 months or whatever. It doesn't matter to us. We're there to just support what people need, okay? And then we do a lot of exercise rehab stuff along with it. Any questions on neck before I jump to low back? I'm talking too long, so I want to get moving. Any other questions? Okay. Low back problems. So the thing about low backs is we've got different regions of the body that are either mobile or immobile, or that have mobility. So a pelvis tends to be less mobile. A hip joint tends to be more mobile. So if you think of the bones of your pelvis, they don't move a whole lot, and then your hip joint moves a lot. Our body has regions of the body. They're all in opposition. So if the pelvis is stiff, the spine is mobile here. Then the thoracic spine is less mobile. The cervical spine is more mobile, and the same thing down the rest of the body. So what happens in the low back is we have this really stable pelvis that our legs are anchored to and our spine is anchored to. So most of us do behaviors and movements with our low back that provoke disc tissues and ligaments to become more damaged in the low back, okay? And it's very predictable. Like you can almost pick where people have problems very quickly because of the nature of what happens with low back problems. So too many people, we bend, we hinge, we lift, we twist, we pick up things, we drive, we sleep. You know, we do things in manners that provoke low backs to become angry, just like necks. Some of the most important parts of this is how we stabilize and how we move our spine. So again, like with the head and neck, can we keep our head and neck in a more neutral posture? And same thing with the lower back and the lumbar spine. Are we able to hinge properly here through our hips and keep our spine in a neutral position so that we don't find those tissues of our spine becoming more and more damaged? Again, muscle strains, sports injuries, lifting, falls, you're going to see the same issues. You're going to see muscle soreness, tightness, redness, swelling, things like that should recover relatively quickly. Ligament injuries, twisted funny, lifted poorly. It can happen here, it can happen anywhere, right? I mean, if you're doing things you're pushing your body, you're going to notice that you can tweak things somewhat easily. Again, ligament injuries are going to take a bit more to heal. They take more time. Disc injuries, definitely the most common. Again, it is that squishy part of our spine that absorbs so much. It's what allows us to bend our spine like this and fold over and then fold back up. The muscles are helping, but every one of those discs is then bending and squishing to accommodate that movement, right? We can look at something. Who has tight hamstrings? Oh, you're not fair because you just had your hip done. Come on up. What's your name?
Chris.
Hi, Chris. Nice to meet you.
Nice
Bob.
to meet you.
Okay, so can you bend down and touch your toes?
Yes.
Okay, cool. So, and then go ahead and lay on your back for me. We're going to take one leg and just let that relax for me. You don't have really tight hamstrings. Who has tight hamstrings? All right, come on up. Chris, that was a great example, and thank you, but I need tight hamstrings. What's your name?
Eamon.
Hey, Damon?
Eamon.
Eamon, nice to meet you. Go ahead and lay down for me. Okay. All right, Eamon, let's see what you got. So let that relax. All right, so if you were pulling his leg, that's starting to feel tight right there, right? That's as far as he can go, all right? Come on up, though. Let's see you touch your toes if you can. Okay, so he's close, right? So my point in showing you this is that his ability to get to the floor, if you saw where his leg only went to about 45 degrees, right? So if that was as far as he could get with hamstring flexibility, that means he's getting to about here. But now he's getting all of that motion down to here through his spine. So he's getting my point is most people's flexibility comes out of their spine instead of their hamstrings, right? So can we teach someone like Eamon how to shift that balance? Because the more tension you have in your hamstrings, the more tension your back is going to absorb, right? These are long, big, strong bones. These are small, tiny bones. The more you bend like this, the more stress those little bones have because these ones are big and strong and stable,
So you're
right?
saying he's compensating with his upper back by curving too much to get down to do a deadlift, for instance.
Right.
Potentially.
Yeah,
Okay.
yeah. Compensation, how he's born, how he learned, like, I mean, you know, it's all kind of the same. I don't know. It's not the same thing. But anyway, I think you get my point. Is that we would want to create a balance there, right? To protect his back better, we would want to increase his hamstring flexibility to reduce the chance that his low back has to kind of tolerate all the stress. Okay? Does that make sense? Okay. Thanks. Appreciate it. Anyone have questions around that? Okay.
Yeah, how do we do that?
How do, which part?
How do I help a guy like Eamon in my classes to begin to open up?
Well, boy, maybe a long answer, but it would also depend on how well he moves. So just because his flexibility is off, maybe isn't as optimal as someone else's, watching how he moves through movement patterns is actually really important because that may not hinder his ability to move and squat or deadlift as much if he has good mechanics. And then we don't worry about it as much, right? Because if someone's moving well or moving more correctly and they can protect their spine through hinging motions. For example, like if you're gonna do a deadlift, right? And you wanna get to the bar on the ground, let's say he can only get to here because that's how far his hamstrings go. But if he gets to this position and he goes straight down, what am I worried about, right? Like he's maintaining this and he's stable and he's able to get to the ground and create the movement pattern. So now flexibility is not as much of a problem.
But do we limit how far he's going if we start to see this?
Absolutely, right? That's absolutely important from a training point of view. You don't want someone to go to the ground, get to here, and then go to here, right? That's not what we want to see, absolutely. It depends. So what you're kind of asking is like from a training point of view versus like how do we protect the spine? So they're the same but different. So like if he came to me and he's complaining of back pain, then I would be approaching how to stabilize the spine, but also loosening up his hamstrings so that we can reduce stress in his low back, right? So kind of a different but the same. Yeah.
Take on Jefferson curls for that.
Which ones?
Jefferson curls.
Which ones are those? I forget that name.
Something about, you probably do no weight if you have bad and you kind of go down, you try to open up your vertebrae all the way and get below your toes. And you come up just super slow.
Yeah.
But usually with weight, you know, if you can handle it. I don't know. Yeah, you're just trying to open all the vertebrae all the way back, and you go back up slow, and you just do it again.
Yeah. Yeah, and so that is a great way to strengthen the spine, but from my point of view, it would be a little concerning depending on if there's an injury present, right? So because bending every joint in the spine is great if you don't have any injuries. Yeah, and that's the scary part, is that when people do have something that's injured, like you don't want to provoke it in that direction. Yeah, exactly. Yeah, but no, that's a great stretch.
Wouldn't you either lift with an octagon, like, you know, one of those
Hex
guys?
bars, yeah.
Or put some bars here so then you don't have to go as low, but you're still getting your lift in?
2 kettlebells is a great way in here. I oftentimes do my deadlift with 2 kettlebells.
Yeah, so there's a lot of accommodations you can make for.
Keep your back straight.
Exactly.
Use that booty.
Use the booty.
That's a question for you too. Like,
Yep.
So obviously deadlift bar, the weight's more in front of you than deadlift kettlebell, where the weight can be like back under your hips.
Right.
Do you have any recommendation on that for
Again,
an injury?
so like I think you guys you're getting the gist of kind of where I come from, but like the kind of problems that I see, I tend to see people come to me and Dr. Rachel because they have a problem and it hurts. So my brain is always more, I'm trying to protect somebody and get them to rehab to get back to better function, but being highly aware that you don't want to provoke your problem, whatever it is, right? So like while Jefferson curl is a great way to strengthen a back, it's a poor choice if someone has an active disc injury, okay? So what Sean's saying here is, is one method of a deadlift better than another? It depends on who's doing it and what their problem or issue may or may not be. If you want to err on the side of being safe, any kind of a deadlift where you're doing it between your legs here, right? So that's just easier to move, or barbells on the side or dumbbells on the side is a whole lot easier than hinging here and holding onto a bar in the front. If we pulled out a bar, I'm sure if everyone tried this, you would feel, if I said get to here with a barbell, you'd be like, oh yeah, I feel that in my hips and my low back. But if you had it here and then you squatted like this, you'd be like, no, I feel that in my quads and my shoulders and a little bit in my low back. Like the stress load changes based on the orientation of the weight, right? So then which one is more important for your particular problem or what your particular goal might be? If you just want to stay safe and avoid the potential for back injury, keep your spine more straight all the time. You're not missing anything. You know, being able to pick up a car is not something most of us need to do. So we don't all need to deadlift. It's a great, powerful movement, and I'm not saying it's a bad exercise, but if we want to avoid the potential for injury, then I always encourage people just to stay away from things that have a higher potential. All right, we don't have any dowels in here. That would have been good. Okay, a couple quick things. We're just going to move on because I got a few minutes left. So the biomechanics part, again, we're kind of talking around it right now, but what I want everyone to do, again, grab a partner, and I want you to try to work on hip hinging. And what that's going to look like is as you stand, you want to engage your core, and you want to feel like it doesn't need to be rock solid, but just have your core tightened up. And as you bend, you want to think motion through your hips. So I'd encourage you to put a hand on your chest, hand on your belly, and move slowly. So as you bend and have the person watching you, are you able to keep your spine neutral for as long as your hamstrings can allow you to move? So if everybody watches me for a second, I can go from here to here. That's where my hamstrings allow me to go. And I can maintain my spinal neutrality by doing that with a straight leg, okay? And I can come back up. So knees are straight. Knees are locked, or mostly locked. So check your partner, watch how they do it. Okay, gang? A couple last quick things here. Kind of like we talked about with necks, changing daily habits is super important. So again, if you do things like sit a lot, drive a lot, you are in bending positions a lot, doing prone cobras is a really great way to offset kind of the flexed positions that most people behave in all day long. So anyone not know what a prone cobra is? Okay, so who wants the demo? Sean, you want a demo? Awesome. Just lay on your stomach right here for me. Perfect. And then just come up on your elbows first. Okay, so for a lot of people that have back problems, I tell them to exist in this position like twice a day for anywhere from 10 to 20 minutes twice a day. And the reason is if you sit at a computer or do things in a flexed position all day long, putting your spine in the opposite direction creates a lot of de-stressing of those tissues that are constantly loaded, okay? So I call this one a prone cobra 1, and then prone cobra 2 is going to be like press up. Yeah, hands out and then press up, right? And then this one I have people do is like a pumping mechanism for the spine. So you press up, you hold it, go ahead and go back down, and then back up. So I have just go up and down, basically. You go up, hold it for a second, and go back down. Yeah, and so you can go up and down is my point, okay? And I have people do that.
Are the hips relaxed?
Yeah.
Are they engaged?
Yes. Completely relaxed. You should be using your arm muscles for all of this. You don't want to be engaging back and glute muscles.
You should be floating.
No.
Okay.
No.
Floating, Sean.
Yep. Okay, so again, this is just quick tips on just stuff that you can kind of walk away with and change hopefully your daily lives if you do a lot of sitting, okay? This is a great exercise. I encourage people to do this like every day, 2-3 times a day if you can. The prone cobra 1, you press up, do 15 or 20 repetitions like 2 or 3 times a day also. Simple things like try to reduce the amount of time you sit, try to stand more. If you do sit like in the evenings and watch movies, lay down on your couch. Don't sit and just slouch into your couch because that slouching posture aggravates tissues in your low back and can make disc injuries like a lot worse, right? So we'll get into that. We can get into that more if you want. So the same thing with necks. Chiropractic care is awesome for low back stuff because there's so much tension and stress built up in those joints. If we can get them to loosen up and then we can start applying things like the posture stuff we talked about, the prone cobra, changing behaviors of sitting, it starts to change the way you interact with your day. And that's probably one of the most important parts. Adjusting facilitates that reduction of pain, reduced muscle tension, better function, all that stuff. So it's just a highly useful tool. And if we can add exercises and change your daily behaviors, then we're giving you a different path to go on. Okay? I've taken up an hour and 3 minutes of your day. So thank you so much for coming. If you have questions or you want to stay and ask us more questions, please do. Thanks.
Quick shout out for Bob. He's helped me through a disc injury. He's helped Christine through a disc injury and has been awesome at it. So if you ever have back problems, neck problems, go see this guy.
Cool. Thanks. Awesome.